Um, Thank you for joining the How to Be Smokewise webinar today. My name is Chris Chambers. I'm the Wildfire Division Chief here at Ashland Fire and Rescue. And joining us today, we have speakers from the Oregon Health Authority, Jackson County Office of Public Health, as well as in our own fire department here. So we're gonna hear from a variety of folks on different topics related to being smokewise. Just to back up a little bit, why we're having so many smoke issues, what are the issues that we are grappling with as a community. As we all know, smoke has become all too commonplace over the summers during the last 5 to 7 years. Some years are a little bit better than others, but by and large, we have seen smoke, and sometimes really heavy and very unhealthy smoke. In some of those summers, of course, we've had fires near us threatening our town. And all of this is related in part to climate change. The changing climate has lengthened our fire seasons by up to 70 days nationally. So what used to be just a short few summer months fire season now has expanded out, and the peaks of that fire season are much higher and worse as temperatures are hotter, like they were last summer. And the vegetation is just much drier and ready to burn. Our snowpack is not what it used to be, so the upper elevations become ready to burn much sooner than they used to be. And we often describe this this fire paradox. And what we mean by the fire paradox is, though it seems like there's a lot of smoke and fire out there right now, but actually, historically speaking, and maybe looking ahead a couple of decades where we can get to be in front of this problem and not behind it, is we would see even more fire, but instead the kind of fire that is beneficial for the landscape and protective to communities when used appropriately. Because we engaged in this experiment over the last 150 years of putting out all fires. And clearly, looking at the last decade, it has not worked. So the paradox meaning that we put out, the more fires we put out, the worse that the fires that don't get put out get over time. And so what we need to do is much like what the city of Ashland and our community and our partners have engaged in over the last 15, 20 years, but especially the last 10 years with the Ashland Forest Resiliency Project, becoming stewards of our watershed, recreation resources, which we're seeing here, but as well as becoming stewards of the forest, knowing that it's the source of our water, 1 billion gallons of drinking water that comes from the Ashland Creek watershed that sits above town. And of course, the backdrop to our lives here in this community, to the tourism economy that so many people love to come and visit Ashland, not just to see plays, but a lot of people are coming to this town for outdoor recreation, coming from outside of the area. So it's really important to our economy that we are good stewards of our forests. And ultimately, that means we need more good fire on the ground. If some of you are out and about today, you probably saw some smoke coming from the hills. And that is, there were 2 different control burns today. Sarah will talk a little bit more about that. But we need to have a lot more proactive fire in our forest lands to reduce the fire danger out there, so that when fires do come, they're not big, bad fires that burn the tops of the trees, but they are more mild fires that forests can survive, especially in the face of a changing climate. As trees continue to struggle through droughts like we're having right now, they don't need that added stress of intense wildfires added onto droughts as well. So just a quick background on why we need more fire and that fire paradox, which also means for protecting human health that you all need as much information as you can get. And that's why we've engaged with the Oregon Department of Environmental Quality to create a community response plan for smoke. The city received a grant last year to build this document, primarily to guide our actions and making resources available to you, the citizens, our community, and to create some priorities. And then we were also lucky enough to get additional funding in the current year from DEQ at the state level to implement our community's smoke response plan. So part of why we're here right now is because we have this grant and we're implementing it. And we're trying to get more and more people as new people move to town, as other folks just haven't heard about Smokewise Ashland, for example. But knowing how to prepare your home and how to take actions to protect your own health when smoke is in the air, whether that smoke is during the summer from wildfires or that smoke is from controlled burns that we're proactively putting onto the landscape. Smoke is smoke. We know it's not good for anybody. And that's why we need you to be informed and have all information at your fingertips, because smoke is going to continue to be part of our lives. There's just no future where it's smoke free anymore. And that's just the unfortunate reality of where we find ourselves living right now. And so there's a lot of changes that are happening around us. So I'm going to pass off the baton now to Sarah Jones. Sarah is our community engagement coordinator for the Ashland Forest Resiliency Project, and she works here out of Ashland Fire and Rescue. Take it away, Sarah. Thank you.
Well, it helps if I unmute myself. Thank you, Chris. As Chris was saying about the community response plan, that's helping us get prepared for summer smoke. And I started organizing for the Ashland Forest Resiliency and this issue around smoke with Smokewise Ashland in 2016. And as a benefit of that, we are able to help the community not only prepare for smoke when we have controlled burning, but also for summer smoke. And so it's a huge benefit to the community to have that community response plan. So what you're looking at here in this first slide is a satellite image of recent fires. The large wildfires in Oregon have increased awareness of smoke and prompted investment from the state of Oregon in Senate Bill 762, which is a multi-million-dollar 5-year investment for smoke and fire resilience. And that's partly what is paying for my position in, for the Ashland Forest Resiliency and helping us get this work done in the community. So research by the University of Utah found summers in the West are increasingly marked by wildfires and smoke. For the years studied from 2000 to 2019, researchers noticed that the mean air quality was worsening in the Pacific Northwest, which is really alarming and is a big indicator that wildfire smoke events is affecting the overall air quality. But we don't have all bad news. As the smoke trends upwards, we are looking at the bigger picture. So researcher Rick Raw, who is the Region 6 air quality specialist for the Forest Service, is researching historic wildfire smoke trends to help forest management in terms of identifying wildfire emissions hotspots that are particularly relevant to air quality in the Western US. So by allocating those limited wildfire prevention dollars, we have some intervention that we can do using prescribed fire and forestry to reduce that wildfire emission over time. So in this slide, you saw the bigger picture with the smoke that we're getting from our wildfires. In this picture, you can see it more on the ground. In these images, you can see New York experienced our air pollution in 2021. And then in the second image on the right, you can see the 2018 smoke that was at the Oregon Shakespeare Festival. So when smoke is traveling these long distance, it impacts people in large population areas like the Rogue Valley in the summer, and we have smoke settle in low-lying valleys. And the fine particulates are nearly invisible at low levels of pollution. but when the AQI is higher, the firing particulates collect enough to be seen. So as those particulates accumulate, they become visible. Next slide. So this air quality graph is from the US EPA for 2021, and it shows Jackson County continues to have significant air quality impact during the summer wildfire season. Periodically during the month of September 2021, uncontrolled smoke from regional fires in Northwest Oregon, Eastern Oregon, and Northern California pushed PM 2.5 above the 20-year average and 5-year average. So Medford's air quality frequently remained at or below the 20 and 5-year average for all of the rest of the year outside of that wildfire smoke season. Next slide, please. And so I wanted to show you some good pictures of what our controlled burns look like. You can see the picture on the top is a pile burn that we did in the fall. And then the picture on the right is a picture of our underburning that we did last December for 55 acres and to that summer smoke. And there on the bottom right, you can see the Riverside fire. And for that one, that severely impacted the Portland area. And then that bottom slide or bottom picture, you can see a picture of the Archie Creek fire. And you can see how high those particulate levels were when the smoke was close to the ground. For April 15th and December 10th, we activated our CRP. And we did have overnight some smoke that went into the unhealthy level for sensitive groups briefly overnight. But you can see the majority of the smoke particulates that we had were during those summer months of August and September. And next slide, please. So each time we have a controlled burn that's done on public lands, city forest lands, or on private lands as part of the Ashland Forest Resiliency, a controlled burn message is sent to notify you of potential smoke impact. So there are several ways to receive a non-emergency controlled burn notification from the Ashland Forest Resiliency. You can text watershed to recipient 888-777 on your phone. On our homepage, ashlandwatershed.org, we have an email request form to sign up for emails. And this web page is the best way to check for updates during the day when we have our controlled burning. Also on Facebook and Twitter for social media feeds to get those updates. So for emergency notifications, we use that same Nixle system in Ashland. You would text our zip code 97520 and the message line to 888-777, the recipient. As part of your packets, we sent links to all the resources posted on smokewiseashland.org. And there are a lot of resources that go beyond smoke. We have great links for wildfire evacuation and preparedness. So I know we're supposed to assign homework at the end of class, but I wanted to make sure and plug that you explore those great resources on smokewiseashland.org as part of your homework for the class. We have pulled together resources for smoke and health from reliable sources on smokewiseashland.org, like Oregon Health Authority and the CDC. Plus we have links to wildfire resources. I know for some of you getting this electronic form with QR codes may not be the best format. So I encourage you for extra credit points to reach out to somebody in the community that can help you with accessing all those smokewiseashland.org resources. And you can also access it in a traditional way of logging on and putting in smokewiseashland.org into your browser. And that's all I have for now. Thank you.
Thank you, Sarah.
Thanks.
All your work with Smokewise Ashland. Sarah has been on this project from the very beginning and has poured an enormous amount of time into making Smokewise successful. Okay, we're moving from Sarah now to the Oregon Health Authority. We have Ali Hamadeh, and he can introduce him with his correct title, although what I looked up sounds really good, but I just want to make sure it's right. So I'll let him do that. And he's going to here to talk more about smoke and health. Thanks for being here, Ali.
Thank you, Chris. Thank you, everyone. I'm with the Oregon Health Authority. I serve as a deputy state epidemiologist in the public health division. I'm also a toxicologist by training with specialty in air pollution. So this is always a good topic for me. Do we have slides somewhere? Yeah. Okay, so I'm going to talk a little bit about the health risks associated with the wildfire smoke and things you can start doing today to prepare for any potential wildfire, and some things to keep in mind for during the wildfire and after the wildfire. Next slide, please. I have two pictures here on the right. This was September 2020. It was in the middle of my vacation. I chose that 1 week to take a vacation. And this was halfway into it, driving up the coast. You guys probably see, and this was around noon. You guys probably see a lot worse more frequently. So, and on the left, it's a message from Smokey the Bear. To really make sure you put out those fires, because that's a major risk factor for how some of the wildfires start. Next slide, please. So what's in smoke? There's carbon monoxide and other gases, aromatic hydrocarbons, particulate matter, and a bunch of other components. I'm going to focus on particulate matter in the coming slides, but just a few words on carbon monoxide. It's mostly a health issue for those very close to the fires. Mostly it's a thing with firefighters and other response crews in the immediate vicinity. It could be a major issue depending on the wind and meteorology and how bad the fire is. And the AQI could be determined by those depending on how bad it is. But usually particulate matter is the major driver for the rest of most of the population. Aromatic hydrocarbons, some of them have been associated with causing cancer. And if it's a brief exposure, it might not increase your risk tremendously, but with more and more wildfires, it could become an issue and the risk could be increased. So all the more reason to shelter from these exposures. Next slide, please. So particulate matter, if you look on the right, there's that kind of long strand, long tube that's depicting a human hair. And you can see the grain of sand next to it. And those small blue and red dots, those are the ones that have been associated most with bad health effects. So PM10, it's particles that are 10 microns in diameter and smaller. PM2.5, that's got the strongest association usually with bad health effects, and that's 2.5 microns and smaller. So you really can't see them with the naked eye. You can see them, when they're enough and they're causing haze. And the significance of this size is, if you look on the left-hand side, they're small enough that some of them, the really small ones, or components of them, you get into our bodies. Some of them can go into our brain, lungs, naturally, blood, heart, liver, and they can cause some of the adverse effects over there. Next slide, please. So who are we're all affected by air pollution to different degrees, but I'm gonna split it into two major categories. So one, on the left, you have the sensitive or susceptible populations. And those are people who are more likely to experience a bad health effect from any one exposure more than others. And for example, those could include those with pre-existing heart and respiratory disease, people with allergies, older people, infants and children, their lungs and the rest of their bodies are still developing. They have a high respiratory rate. They can get a higher dose during the same time from different pollutants. Pregnant women, because it can affect the fetus mostly. Again, healthy subjects can also be affected. Some might not be. Vulnerable populations, and those are people, depending on where they live or what they do, they're more likely to be exposed. And therefore, they're going to be more likely to develop health effects than somebody who's not exposed, given everything else being equal. So, for example, if you're working or living downwind of the smoke, you could be more exposed. For example, if you're a migrant seasonal farm worker and you have to be outside all day without adequate protection, and you have to work for different reasons, you could be more exposed naturally working or even running if you're exercising outside. That's going to increase your respiration aside from just being outside, and that's going to increase the amount of pollution you're exposed to. Those experiencing homelessness, they might not have access to the different protections or whatnot, so they're vulnerable as well. And those with low income, naturally, again, they don't have as many resources as some other people, like acquiring an air conditioner or air purifier. Next slide, please. So what are some of the health implications? You could have heart disease. For those with existing heart disease, you might see a heart attack, irregular heart rhythm. Depending how bad these are, you could have premature death even. I mean, that's a smaller portion of the population, but these things can happen. If you have existing lung disease, you might have worsened lung function. You might have an asthma attack. And again, those could be life-threatening conditions. So one needs to really be in touch with their healthcare provider, have medication, have everything ready and prepared to counter that. With pregnancy, studies have associated particulate matter exposure to preterm birth, low birth weight. So that's a population that needs to take care as well. And for most people, we'll experience nuisance symptoms, eye irritation, scratchy throat, mild cough. There's also concerns about exposure to contaminants after the fact. So when you're cleaning up during ash and debris cleanup, this could bring up respiratory or other concerns. And the mental and behavioral health issues, I mean, that's something important throughout, especially these 2 past years. I mean, with COVID, it's brought out a lot of anxieties in different people. And you could think of it this way. I mean, you have anxiety from COVID, it's just heightened, and you're anxious about losing your home, getting exposed to harmful substances. So it's really important to take care of that and reach out to a healthcare provider or somebody you trust to talk with, and make sure you're equipped with the different tools. Again, you want to make sure that the water is safe to drink and it's not contaminated. Next slide, please. And just an example of how we're able to measure some of these bad health effects. This is just one example, and we use this system called Essence that we have. We collect data from emergency departments and urgent care centers. And we were able to look at, if you look at the blue line, that's the 24-hour average fine particulate matter concentration averaged across the state. And you can see that, somewhere there in September, it peaks really high. And we mapped it or plotted it against the daily asthma-like visits from all these centers, and that's in the orange line above it. And you could see a really nice it goes, these visits increase as the particulate matter concentrations increase. So this is something that was clear, and it just reinforces our knowledge about these health effects. Next slide, please. So what are the things you could start doing right now? If you don't have it already, make sure you have a plan for food, water, medication, evacuation. Yeah, that's always recommended. Learn about respirators like N95s or equivalent or better respirators, and we'll have a slide on them later and more about it later in the class. Make sure you have some on hand. The federal government distributed a few weeks ago. Maybe you got some. These were for COVID purposes, but that's what we're talking about. You want to identify a clean airspace in your home and community, somewhere if you cannot leave the area when things get really bad, you can shelter at your home and make it as clean as possible. See if you can get a HEPA air cleaner or a do-it-yourself option. We'll also talk about this in a bit. Be connected to the DEQ air quality alerts to know how bad the air is, and that comes along with recommendations. And really, something we're adding recently, eat well starting today. There are few studies that show evidence that a diet rich in fiber, fruits, vegetables, and omega-3 fatty acids reduce the air pollution health effects. So that's something that is a win-win situation. You could eat this, feel better anyway, and hopefully it'll reduce the risks from wildfire smoke exposure. Next slide, please. This is a little bit about the air cleaners. We have two options to consider. There's on the left, there's a do-it-yourself or DIY option. And basically it's really putting together a box fan and a furnace filter and taping them together, somehow securing them with rubber bands or Scotch tape. You want to make sure that the furnace filter is a MERV 13 rating or better, because that's the one that really does a good job filtering out the small particles that we're mostly interested in. And make sure when you run it to be around, do not leave it unattended. Those have not been tested by companies. Apparently it's a do-it-yourself option. So if a fan is not built for it, if it overheats, you want to be there, just turn it off, do not run it, do not keep it on overnight. If everything is sealed well, once it does its job, it should last for a little bit, for a few hours actually. So you'd be good to go through the night. And then on the right, you have the HEPA or electrostatic precipitation technologies. And those you just buy from the store. You see that first bullet, that's a link to a clear kind of a list of approved or verified air purifiers. It's not an exhaustive list because people can, have to buy into that list, but you can be sure that those are verified once you get in there. If you go with an electrostatic precipitation technology, pick a non-ozone producing precipitator. Some of them generate ozone, and that's not good to breathe if it's high enough. Some of them produce really low levels, and that's fine. Next slide, please. And in terms of the respirator, this is an example of an N95 respirator. This is the one like the one I got from the CDC a few weeks ago. For these, you want to make sure that it's a proper fit. The better the fit, the better it filters out the particles, and the better it protects. Now, it doesn't protect against gases, but particulate matter is really a big risk driver. You want to perform a leak check after putting it on to make sure that it's really doing its job. And there's a link below from OSHA that shows you how to do that. Of course, these could be really tight to the face, and that's part of the reason why they work so well. It could be uncomfortable for some. For some with heart or lung disease, they might not do great in them for long periods. So, make sure you talk with your healthcare provider before wearing one so that you could reduce the risk of any unintended consequences. Next slide, please. So during the wildfire, it's important to follow your local public safety, local or tribal health authority, DEQ and OHA for recommendations. Implement your preparedness plan as needed. Take care of yourself, your pets. Pets can also be affected by wildfire smoke. So, you know, if they're small enough, you could take them with you wherever you go. Yeah, take care of your family, neighbors, friends. I mean, this is community resilience and supporting each other. That's always a really helpful thing during these times. You know, some people might not have somebody to help them evacuate or get them supplies. So this is a really good opportunity to start strengthening these bonds, looking into, you know, people who might need that extra help. And I understand some people might be concerned about their livestock, and we're not going to go into that today, but there's a link down here that from the Department of Agriculture that talks more in detail about what you can do. Next slide, please. So after a wildfire, you want to reduce exposure to ash, which has a ton of particles once you start agitating it, and other pollutants. Again, you might want to consider those HEPA filters or do a DIY options. You want to use damp cloth to wipe surfaces if there's any residual smoke or ash. Avoid having kids and pets playing in the dirt. If you're going to be out in the ash or whatnot, wear protective clothing and a respirator. And of course, remove shoes when going indoors. Other tips include washing your garden produce because ash could have settled on them. Make sure your drinking water is not contaminated. There's a link below that talks about a project that OHA is conducting where they actually could test your well water for free if you've been in an affected area. And take care of your mental and behavioral health. You know, start getting connected, you know, today for all purposes. But during some of these more stressful times, it could really come in handy if you know who to call and if you're well equipped to think it through and, you know, all the tools you need. Next slide, please. These are some extra tools for crisis and emergency risk communication. You have the Oregon Smoke blog, and then our wildfires page, and then we have a recovery page down there. And most importantly, download the Oregon Air app. That's supplied by DEQ, and it can tell you how bad the air is wherever you are in the state. And next slide, I think that might be it. Thank you.
Thank you so much, Ali, for all of the great information and all of the excellent work you do for the citizens of the state of Oregon. It's much, much appreciated. All right, we're going to switch gears to more of the local level now. Tanya Phillips from Jackson County Health and Human Services is here to talk to us about health messaging and understanding the air quality index. Take it away, Tanya.
Hello, thanks for having me today. As Chris said, my name is Tanya Phillips. I work here at Jackson County Public Health. I am the Health Promotion and Preparedness Manager. So often come summertime, I do a lot of interviews with the media, providing risk communication, really providing situational awareness, and then providing those tools that the public can use to help minimize their exposure to wildfire smoke. So that is my introduction, and we'll go over some of those tools, including the air quality index in my presentation. Perfect. So next slide. So as I mentioned, during wildfire season for public health, we want to ensure as much as possible that we are able to help individuals and the public as a whole really reduce the amount of time and frequency that they're being exposed to wildfire smoke. And so in our presentation today, we'll go over some of those tools, but you'll see a lot of this is really what the state talked about already as well, but we really try and make sure that those tools are available and that individuals know how to use those so that they can reduce their risk or their exposure to wildfire smoke. Next. And as already mentioned from the state, so thank you. Wildfire smoke, again, what is it? It's a mixture of gases and fine particles from, you got burning vegetation, building material, and other materials out there. And it's that particulate matter 2.5 is what we're most concerned about because of that size and it can bypass the lungs and get into the blood system as well. And we really talked about already who's at risk of experiencing health consequences from wildfire smoke exposure. Everybody at some degree are going to have immediate health effects due to air quality, especially as it worsens. But those at-risk populations, again, just to reiterate, are the older adult population, pregnant women, children, individuals with chronic respiratory and heart conditions, but also people that experience low socioeconomic status. And we've seen this exacerbated, especially with the pandemic as well. Next slide. So overall, these 6 things that I have up right now are really the messaging around during wildfire season of what individuals can do. And so that the first one is pay attention to the local air quality reports. Take a look at the air quality index. Do a visibility check. So that's another tool in the toolbox that we can use, and we'll go over that a little bit more. You will definitely hear us talk about the best way to protect your health is to limit the amount of time that you're spent outdoors. Go inside more frequently, and if there are outdoor activities that you have planned or recreation, to cancel those, especially as air quality worsens. And then keeping your indoor air quality cleaner is very important as well, and we'll touch on that piece. And then for people who have those chronic health conditions or at an increased risk of experiencing illness, not feeling well, exacerbated symptoms from wildfire smoke, touch base with your doctor and make sure that you're following those orders as well. And we'll touch on the masking as well in there. Next slide. So this is the air quality index. You'll often hear us call an AQI as well. So this is really a uniform index for reporting daily air quality. You know, it provides a predictive information in real time. And I'll go over what that real time really looks like. It provides it at a local level. And as you can see, it provides that guidance for reducing exposure. And it's also color coded as well, which is really helpful. So overall, when you're looking at the AQI, it's divided into 6 categories. It corresponds to different levels of health concerns. And then, as I mentioned, it's associated with the color so that we can quickly identify what the levels may be at. And so looking at the AQI, you know, green is good. You know, there aren't any issues. And as it decreases, yellow is moderate. So some people may have some sensitivities to the air pollution, and those individuals need to pay attention to that piece. Orange is unhealthy for sensitive groups. So again, it's those higher risk groups may start to really feel those effects from the air quality. Red is unhealthy. So again, you have a broader population now that's being impacted by the wildfire smoke. Purple is very unhealthy, and the maroon is hazardous, which we know in Southern Oregon, we frequently reach that maroon and purple level. And then also just a quick note, looking at the AQI and the color coded, we do have this system built for schools so that they can really monitor the AQI as well. And it provides guidance on the outdoor activity for children while they're in school as well. Next slide. And this is a screenshot of the Oregon DEQ, their air quality monitoring map. And as it was mentioned by Oregon Health Authority, you can download their app. This is actually one of my favorites apps to look at air quality. But each of those dots are monitoring sites. I have it specifically right now selected to that PM 2.5, but you can select all of them. In Jackson County, we have three sites, so the Central Point, Medford, and Ashland, so right up that I-5. And so for this one, it is updated on typically about 15 minutes past the hour, and it's reporting the previous hour. So when we talk about real time, you can see some gaps in that. part. So there is a lag, which is why it's really important to also use the visibility guide when you're making decisions about your health. If you can go outside, do yard work, run to the grocery store, whatever that may be. Other sites to look at is the Air Now, which is through the EPA. The Oregon Smoke Blog is another great site. It does have, again, a map, and it does show some other monitoring sites, and that one's great. So during wildfire season, sometimes we will place monitors that we get from EPA or U.S. Forestry throughout the county, because Jackson County is a large county. So, when we have fires that are closer, out in Shady Cove or in Klamath, there's parts of Jackson County that are being impacted by smoke at a greater rate than sometimes Medford or Ashland may be. And so those monitors aren't necessarily accurate for them as well. So again, there's multiple tools that people need to use when looking at this. This is just one of those tools. And then also the EPA, they have an app as well. So you can, again, and just another option. And I think it's really just a preference of what you want to pick. And then when it comes to wildfire smoke, as we all know, our Jackson County is a large county, like land-wise. And depending on the fire activity and wind direction, weather patterns, our air quality can change dramatically. And these air monitors aren't going to catch up with that. And so with that, then I want to talk about using the visibility guide as a tool to make some decisions about going outside and what to do. So if you can go to the next slide. So this is the visibility index. It's located on the DEQ website as well. And it's really looking at the 5 mile, 3 mile, and 1 mile so that you can take a look outside and determine, can you see 5 miles at a certain site? Can you see 3 and 1? And then it's associated with the different categories of your risk, and then what to do. So really, let me look here. I know the distance can be a little tricky, but here's some tips on that. So when you're trying to identify a site, it is recommended to identify targets that you're familiar with. In Ashland, Medford, Central Point, we're all going to have different locations, but some of those locations can be mountains, hills, buildings, and that where you really do know the distance is helpful. The visual range is that point at which these targets are no longer visible. And as a general rule of thumb, if you can clearly see the outline of individual trees on the horizon, it's generally less than 5 miles away. So those are some tips, and it is on the DEQ website that reiterates those as well. You also want to make sure that the sun is behind you, because that can impact the visibility aspect of it. But looking at this, you have the UR, so your different risk categories, 5 miles or less. So this is really where air quality is unhealthy for young children, adults over 65. If it's under 3 miles, the air quality is unhealthy for everyone. And then you can see that with each of those distance, you can see, what to do, what those recommendations are. So again, just another tool. And this is a really helpful tool, especially in Jackson County. Next slide. And so some of these have already been talked about already, but I'm going to go into hopefully a little bit more detail. Overall, one of the biggest message that you will always hear us talk about is the best way to protect your health is to limit the time that you spend outside. We do encourage people to stay indoors as much as possible. And we know there's some difficulties around that. If you cannot stay indoors, you need to go outdoors. It is really recommended as much as you possibly can to just still limit that time outdoors by really only performing essential activities. If you are outside for longer periods of time, really trying to take breaks by coming indoors where there is a cleaner air space available to you. And then also we'll talk a little bit more about that in just a second, but consider wearing a particulate filtering respirator. So those are the NIOSH N95 or P100s, and I will talk a little bit about the KN95 masks as well. Next slide. So another piece, so as we recommend people to stay indoors more during our wildfire season and when we have these smoke events, you want to make sure that your indoor air quality is cleaner. And so some of these ways that you can help do that, which the state touched on a little bit is already, but if you have an air conditioning system, make sure that you're familiar with the system. If possible, use high efficiency filters to capture fine particulates from the smoke. So again, the PM 2.5. Also set the system to recirculate instead of pulling air from outside. So really take a look at that and see what changes that you can make to make your indoor air cleaner. Even if you have an air conditioning system, you can still consider purchasing a portable air cleaner or even air filters. And if you don't have one of these systems, it's definitely something to invest in. And we do encourage that as part of being prepared is purchasing or creating these do-it-yourself box fan filters early on in the season. We see when we have our smoke events or when our temperatures start to rise, a lot of times these portable air cleaners or the box fans, they become harder to get sometimes. When you're doing this, especially if you don't have an air conditioning system, it is best to identify a room, and you're going to want to close off that room because you want to make that one room a cleaner air space, and it will help those portable air cleaners work a little bit better so they're not working through a larger space. It's also really important not to add to indoor air pollution. So you'll want to avoid burning candles, utilizing gas and propane, smoking inside the home, tobacco products, vacuuming even at times, and frying meat, using air sprays and stuff of that nature. So really, you do want to minimize that type of products and stuff in your house during a wildfire smoke event. And also something, if you're driving in the car, to use the air conditioner, make sure it's not pulling air from the outside as well. Next slide. So follow the doctor's orders. So if you are someone who does have those chronic health conditions or those other risk factors, if you have a primary care provider, it is good to touch base with them, especially prior to fire season, and really have those discussions about what your risks are. Medication, is there medication available to you, and making sure that you have that prescription, that you have access to that prescription, especially during these times as well. And then really discuss with your provider if wearing the respirators is safe for you. So that's one of the downfalls of the NIOSH N95 and P100s is that it does make breathing a little bit difficult. So they're not going to be appropriate for everybody. They're not always going to be the best option. And then, of course, pay attention to your health during the seasons. If you start to experience symptoms, if your health conditions feel exacerbated, definitely pay attention to those and seek medical care when you need that. Next slide. And then on to wearing the respirator. So as we already mentioned, you want to choose the correct respirator. So typically what we recommend is you'll want to make sure that it says NIOSH on the mask, and that is the stamp of approval in the United States, and it's that N95 or P100 that has that capability to filter out that particulate matter 2.5. Now, because the general population does not have access to what we call fit testing, these masks, just like with COVID, they're not going to protect somebody 100%, but it is going to protect you quite a bit. So we always want to make sure that we don't give people a false sense of security that it's filtering all the particulate matter out. And so just making sure that you are aware of that. KN95 masks, we did utilize those was it last summer or 2 summers ago? Sorry, COVID has made I have a horrible sense of time these days. But those are an option. And so there are some past KN95s that did have the EUA from the federal government. So really looking to see if you can find those masks. They are an option and they are going to work. They may not work as well as the NIOSH N95 or P100. So it is, again, another tool in the toolbox. But those dust mask, the bandanas, the cloth mask, they will not filter out that PM 2.5. So they are not providing you any protection. So really go with those other masks if you're going to choose to wear one. As we talked about earlier with the respirators, you want to wear it correctly. You want to make sure it has a secure fit, that it fits over the nose, under the chin, that it covers the nose and the chin as well, and that as much as possible that you can get a good seal around the face. Also making sure that the straps are properly placed. So the straps that go above the head and the neck, you want to make sure that it does that and you're not just wearing one strap. So again, those are little things that do expose you a little bit more to the PM 2.5 when it's not worn correctly. So some possible risks with these respirators, it does make breathing more difficult. So again, if you have those chronic health conditions, this may not be a good fit for you, but you want to work through your medical provider to make sure that it is, or what recommendations that they have. For facial hair, so for men who have beards, you're not getting that good seal, and it really is not providing a whole lot of protection for individuals. Regard if it's PM 2.5 or even COVID, you really want to make sure that you're getting that seal there. We do not recommend that these masks be worn outdoors when you're jogging. Again, it does make breathing a little bit more difficult, and if you have those health conditions, it is going to make breathing a lot harder for you. And then again, just because the proper fit testing just isn't available to the general population, just have that understanding. It's not providing 100% protection, but it is a very good option. And you will hear us talk about, even though we have this as a tool in the toolbox, still one of the best and most effective ways that people can protect themselves during wildfires, during our wildfire smoke events, is to stay indoors and limit your time outdoors. This is especially important if you have heart and lung disease, you are at a higher risk of experiencing adverse health effects. Reducing your physical activity outside, try as much to bring it indoors, using the HEPA filters, cleaning the inside air as much as possible, not contributing to the poor indoor air quality, which we talked about previously. There's always the option of temporary relocation. So if it's going to be a bad weekend in Jackson County with smoke, can you escape to Lane County? Can you go to the coast? So looking at those options, are always options, and they are ways, if you implement those, that it may help you may not be in a position where you have to wear a mask as well. Next slide. And then these are just some resources. They've already been mentioned. So you have the EPA Air Now. So that's where you can find the AQI map, and they do have an app as well. The Oregon DEQ, this is their general page, but I like it because it will bring you to the map, bring you to the Oregon Smoke blog, bring you to EPA as well. Ashland Firewise, again, that is a great resource for us in not just Ashland, but Jackson County as well. Yeah, the Oregon Smoke blog is a fantastic way to get information, and it's really important here because we will post if we have air advisories in place during wildfire season, so you can see what locations in not Jackson County, but throughout Oregon. And then it will also, if we have active fires around us, we do provide a forecast as well. So again, that's a really good resource. And then there's the Center for Disease Control that provides all of these tips and more. Just how to keep healthy, how to prepare for smoke events, and so on. So that is the end of my time. So thank you very much.
Thank you so much, Tanya. That was a lot of awesome information and some great links, including the city's SmokewiseAshland.org is one for local folks. Very much appreciate your time, Tanya. And you did talk, especially at the end there, about wearing a respirator. So we're going to take a few minutes to actually go through how to put on that respirator so that it gets a tight fit and it's working effectively for you. So we're going to welcome back Sarah Jones, and also the man behind the scenes, who's now in the front of the scene as well, Brian Hendricks, who works here at Ashland Fire and Rescue as well. He's our Fire Adapted Communities Coordinator. So I'll hand it off to Brian and Sarah to demonstrate how to wear a respirator.
And so what we were explaining before is that you take it out of the package on one side so they can keep it for later to put away when you're done using your mask.
Yeah.
So you hold the mask in the palm of your hand and take the strap and place it on the outside of the mask, both straps, and open it from the top.
So this one is the top.
And place that gray piece over your nose and the bottom part under your chin. And then you take one strap and place it over the back of your head towards the top. And then the second strap over the back of your head at the base of your head. And then you want to go ahead and make sure that you take all the crinkles and creases out of your strap so that it's on there nicely. And adjust it to center on your face. And then you take your hands on each side of your nose and press firmly in a downward motion to seal the top. Now that you've done that, you cup your hands around the mask and breathe out deeply. If you feel air around your hands, readjust your mask. So if you continue to have air around your mask, consider purchasing a different size or brand of mask until you find one that seals tightly and does not leak around the edges. To remove the mask, cup it in your hand and move the bottom strap off. And then the top strap. And then you will fold the mask up and place it back in your package to keep it clean for your next use. I think Tanya Phillips covered it well, that how to use those masks and where to use them. We recommend that you wear those masks between conditioned spaces when there's high particulate count. So thank you for your yeah, thank you for going along with us on properly wearing that mask. We searched around for a mask that we hope is comfortable for you this summer. I've worn a lot of uncomfortable masks and I hope it does fit. If it doesn't fit after doing your fit test, then go ahead and get a different kind of mask. And thank you for joining us today.
Thank you, Sarah and Brian, for the mask demo. That was super helpful. So we're kind of to the end of our informational piece of this, and we're just down to having some questions that we hopefully can answer for anybody and everybody out there. I know there were a couple that popped up in the chat as we went along. Some of them got answered there. But I know there was, and maybe not everybody is looking at the chat, so we can go back to a couple of those questions. So here's a couple here, most recent questions. Somebody asked, they've been wearing KN95 masks to work out. Is there a better recommendation? And so if that is for COVID or if it's for particulates, that might be different. Anybody want to take an shot at answering that?
OHA, do you want to take the first stab or?
Yeah, sure. Yeah, I was trying to get to that. So yeah, KN95 could be, very good for COVID as mostly as a source control, but it could also help protect you from inhaling anything from other people. One thing to keep in mind about KN95 is that a good number of those on the market are counterfeit. So you might want to look into how to figure out. And there are different articles online that tell you what to look for, what is printed on the KN95 mask or respirator, etc. For wildfire, again, if it's an authentic one, it also provide quite good protection. But you want to make sure that it's an authentic one. Otherwise, you might go with an N95. It's easier to figure out if it's authentic or not.
Thank you, Ali. Another kind of related question, and one that I've had many times, and as we all have experienced smoky summers, I think we get a feel for it, but how long are masks good for?
For me, I mean, the recommendation we've kind of been giving people for COVID purposes or smoke purposes, especially because those are not that cheap. I wear mine, if I'm wearing it every day, all day, I wear it for about a week. Unless it gets really wet and soiled and dirty, then I get a new one. But, they can go a long time if they're not damaged and they're not soiled. Some people wear them for longer. If they just wear them for 10 minutes a day, they can go for longer than a week. So, just make sure it looks fine, no holes, it has good integrity, the straps still make a tight fit around the face.
Yeah, and I'll add the KN95 last summer, OSHA did provide some guidance on businesses being able to use those masks during wildfire smoke events. I personally use them. I use a brand called PowerCom, and you can purchase them. It's called Bonafide, I believe, Bonafide masks. And so on the packaging for that one, there's like a QR code that you can scan to make sure the codes match, and it gives you directions and stuff. I'm a big fan of those ones, and they seem fairly easy to get. If you do get the KN95 or P100, again, you're looking for that NIOSH. You just want to make sure that is on there, and the 3Ms are a good one a good go-to for those. Or even the duckbill platypus ones that I call. Sorry, it's probably not the right term, but that's how I identify those ones. Those ones are pretty universal as well. They don't look as great, but they're a good option too, I would say.
And for the mask that we gave you, sent you in the mail, the 3M, I reached out to the manufacturer and they said that you can use that mask and put the plastic cover on it and keep it clean for as long as it still seals and you're still able to breathe well through it. Otherwise, with the seal on.
Sarah, related to that, somebody did ask about how they could get more of those same masks. Any suggestions?
Unfortunately, we didn't find those from a local hardware store or from Bimart or Rite Aid. We did end up having to order those from Amazon. And the soonest that you can order those from Amazon, the lower that you will pay in price. So if you can purchase those, we were able to purchase 20 masks for I think it was $19.99 is how much it was. And it's definitely worth the investment for your family to do that. And we were able to order those on Amazon. I think someone asked a question about getting USA made masks, and 3M is a US manufacturer, but I think they can't produce as many masks as they need to here in the United States. But if you search US made masks in Amazon, you can come up with some of those, and those 3M, a lot of them are made here in the United States.
Thank you. Another question about HEPA purifiers. So standalone air purifiers that you have in your home. Folks sometimes just keep them on all the time. Is that okay to do? And what are some things to watch out for? Both if you're going to run it all the time, and if you run it frequently during the summer for weeks and weeks on end as we experience those longer smoke episodes. Anybody want to answer that?
I can answer. Yeah, I mean, if the air is bad enough and you need to clean it constantly, then it's perfectly fine to run it all the time. Just make sure it doesn't overheat. You know, they might not be designed to run all the time, so just keep an eye on that. If it's one where you need to change the filter, make sure the filter is not getting overloaded, because that could strain the motor. And it could also decrease the filtration efficiency. Of course, you'll have to change it more often. That could increase your cost, but it's money well spent if your air needs it. If it's an electrostatic precipitator, you just need to, you know, take out that element or whatever and clean it once in a while. So the cost with that is less to maintain. Those are the things to keep in mind, but it doesn't hurt, and it could only be good if the air quality is bad.
Thank you, Alan. What I've noticed also is ordering your filters well ahead of time is worth it, because if you inspect it in the middle of the summer when it's smoky, it is often very difficult to find replacement filters for the more common HEPAs and or even the home filters that fit into your HVAC system that are high efficiency. Which related, somebody just asked a question, Catherine. Hi, Catherine. Do you recommend using MERV 13 filters all year round or not?
Should I take it?
Yeah, go and jump on that one. I'll go through.
Yeah, I mean, MERV 13 are good at removing the smaller particles, including the particulate matter 2.5 or fine particulate matter. So if you're concerned about ambient air pollution, something from cars or wildfire smoke or smoking, you know, cigarettes or whatever, that will do a good job. Inside your home, you could have different sources, dust, whatnot, and those could be up to PM10. So the MERV 13 will cover them as well. And that's, you know, you're talking about the do-it-yourself option. So yeah, that would be great. And some, you know, if you have a HVAC system for the home and your system can take a MERV 13, like it doesn't cause a lot of pressure, then that's great too, because it will filter many of these smaller particles and the larger particles.
And Catherine, just at home, I've done that on mine and accidentally left it in there for many months beyond smoke season, and it didn't hurt anything. But you know, the smaller filtration of an MERV 13, you're going to have to change it more often because it's just catching a lot more of the particles. So you know, you got to be on those more than you would for just a low efficiency filter where you're not really interested in filtering out all those very fine particles during the smoky time of year. So just know that and be ready to check and change your filter more often if you're going to keep MERV 13 in there.
Yeah, and to your point, Chris, during the 2020 wildfires, a friend didn't find any at the store, so they were using a MERV 8, and they said that they were changing them a lot more frequently. Well, a MERV 8 will really not filter most of these particles, the smaller particles, so might as well not use them. So just to follow up.
Yeah, great point. And I've experienced going to the hardware store in the smoke season and finding zero, or one time I got lucky and there was one MERV 13 filter and it happened to fit my system. But if you have any question about whether or not you should have a high efficiency filter like MERV 13 or an equivalent, some brands don't list their filters as MERV ratings. They have other ratings, but you can always ask somebody for help at a store and they can point you in the right direction. So one last question and then we'll let's wrap up. Room air purifiers like HEPA air purifiers are more of a comment perhaps, are indeed rated for the size of the space that you're going to put them in. So if you have places in your home where you frequent and there's 3 or 4 different rooms, you have a really big living room or living space, you may need a larger size filter, and they do make all kinds of sizes of HEPA filters, or 2 or 3 smaller ones. And if you're concerned about the cost, buying a smaller one. You can move them from room to room. I've suggested to people over the years of just, use it in the room where you spend the most amount of time. And if that's in your living room, you can leave it in there, and then you can move it to your bedroom at night, because we all spend a lot of time in our bedrooms breathing air during the nighttime, and it's certainly worth having good air in that space. So those are, I think, an indispensable tool. You can find them at local stores with the HEPA portable purifiers that move around, and or order them online as well. So I think that we're pretty much out of time here, and we want to be respectful of everybody's afternoon and kind of keep this timely for folks who are going to watch it later. So I want to thank all of our panelists for all their time in prepping and spending with us today to deliver this incredible information that is unfortunately and sadly so important for our lives right now, experiencing these smoky summers. But also remember that at times it can be smoky when we're doing prescribed or controlled burning. And that is also a good time to turn on HEPA filters and put on masks. Though those burns are typically short in duration, we have more control of wherever the smoke goes, but at times there will be some smoke in town. So keep that in mind and keep these resources available. And again, thank you all so much for being here. And if you have further questions, you can follow up with any of us via email, and we will do our best to get you back some answers. So goodbye, everybody. Thank you.